Greetings, everyone. Today we're going to be discussing hypertension, its evaluation and management. We're going to do this by talking about three primary different populations: our general adult population, our pediatric population, and our obstetric patients. Hypertension is the leading cause of cardiovascular disease, and understanding its management is crucial for improving patient outcomes. So let's dive in and let's give you all the must-know facts for the family medicine self-exam. First, we're going to start with adults. Hypertension screening should begin at age 18, and it should be done annually. For accurate blood pressure measurements, always check both arms. Use the higher reading if there's a difference of 10 millimeters of mercury or more. When diagnosing hypertension, an office blood pressure of 140/90 or higher confirms the diagnosis, but we need to repeat measurements 2 to 3 times over 1 to 4 weeks. If a patient has a blood pressure of 180/110 or higher, you can diagnose hypertension on a single visit. For out-of-office confirmation, ambulatory blood pressure monitoring or home blood pressure monitoring are key tools. Blood pressure categories are defined as the following. Normal would be less than 130/85. Grade 1 is 140/159 over 90/99, and grade 2 is anything above 160/100. Once diagnosed, assess for comorbid conditions like diabetes or dyslipidemia and check for organ damage. Labs like a fasting glucose, lipid panel, and EKG can help you with your assessment. For treatment, we want to start with lifestyle changes. First, recommend increased fruits, vegetables, and exercise while reducing sodium and alcohol. A helpful tool can be a dietary approach called the DASH diet, the dietary approach to stopping hypertension. In terms of medications, we should consider this for stage 2 hypertension or those patients with stage 1 with comorbidities or significant cardiovascular risk. First-line medications would include thiazide diuretics, calcium channel blockers, ACE inhibitors, or ARBs. However, be mindful of side effects such as polyuria from diuretics or edema from calcium channel blockers. The goal is to achieve a blood pressure of less than 140/90 for patients under 80 and less than 150/90 for those over 80. Lastly, we want to monitor blood pressure regularly. We want to check for resistant hypertension. And if the blood pressure remains uncontrolled with 3 medications, consider adding a 4th or looking for the secondary causes using the ABCDE mnemonic, looking for secondary hypertension. Next, we're going to talk about our pediatric population. In peds, diagnosing hypertension requires accurate measurement and accurate technique, measuring the blood pressure after 3 to 5 minutes of rest. The key cutoff is the 95th percentile for age, sex, and height. Hypertension is diagnosed if the blood pressure consistently exceeds this threshold across 3 visits. Blood pressure categories for children are outlined in your notes, but in general, normal would be below the 90th percentile, elevated between the 90 and 95th, and stage 1 and stage 2 above that. A pro tip here is to use the PEDS blood pressure app to help you remember what are normal blood pressure ranges based on age. As always, we are going to treat our pediatric patients by trying to improve lifestyle modifications first. So we'll focus on things like the DASH diet, increasing activity, and managing their weight. But if that doesn't suffice, then antihypertensive should be considered. Last, we're going to talk about our obstetric patients. In pregnancy, hypertension can either be chronic, meaning it's present before 20 weeks of gestation, or pregnancy-induced hypertension, or severe, where the blood pressure is greater than 160/110. Hypertension in pregnancy can lead to serious maternal risks like stroke, gestational diabetes, or postpartum hemorrhage. It also poses risks to the baby, including low birth weight and preterm delivery. For treatment, medications like labetalol or nifedipine should be initiated if the blood pressure reaches over 160/110, and the goal is to maintain a blood pressure between 120/80 and 160/110. In severe cases, you can think about using IV hydralazine or labetalol for rapid blood pressure reduction. Delivery is typically recommended by 37 to 38 weeks if the patient is on antihypertensives, or earlier if preeclampsia is severe. Postpartum, it's going to be important to continue monitoring and adjust medications to maintain that blood pressure less than 150/100. Lifestyle changes, including weight loss and smoking cessation, are critical in managing hypertension in pregnant women. So there you have it. Hypertension is a multifactorial condition that requires careful screening, diagnosis, and management across all patient populations. And as our future physicians, it's important to understand the nuances of managing hypertension, not only in adults, but also children and pregnant patients. Through appropriate lifestyle changes, pharmacologic treatment, regular monitoring, we can significantly reduce the burden of hypertension and improve long-term health outcomes. Thanks for your attention, and we'll see you on the wards.